Despite being highly contagious, hospitalization and death rates caused by Omicron infections in numerous countries indicate that the variant is less severe. As a result, Denmark, England, Finland, and many other countries have begun lifting or easing restrictions stemming from COVID-19 one after another. The World Health Organization has recommended that nations lift or ease travel restrictions related to COVID-19 in order to help economies recover. However, the WHO also suggests that nations continue testing, surveillance, and gene sequencing. Meanwhile, Taiwan announced on February 7th that it will lift its entry ban on migrant workers from Indonesia, Thailand, the Philippines, and Vietnam beginning February 15th. However, migrant workers must be fully vaccinated and undergo a 14-day quarantine at an approved quarantine hotel, followed by 7 days of self-health management. Most of us might have confidence in the achievements we've made in COVID-19 pandemic management, but how well are we doing compared to most countries in the world? The January edition of the Nikkei COVID-19 Recovery Index revealed that Taiwan is number 1 in the world among 122 nations surveyed. In all categories in the research, Taiwan scored 82 out of 100 in categories that include infection management, vaccine rollouts, and social mobility. The higher the ranking, the closer a nation is to recovery, characterized by fewer infections, higher inoculation rates, and less strict social distancing measures. Taiwan ranked number 1, followed by Cambodia and the United Arab Emirates. Meanwhile, China scored 77 out of 100 and ranked number 4, while Japan came in at 67 and the US at 46. From the beginning of the COVID-19 pandemic, through a joint UN emergency initiative, approximately 87,000 tons of personal protective equipment was procured between March 2020 to November 2021 and shipped to support countries' urgent COVID-19 response needs. Unfortunately, most of this equipment ends up as waste and doesn't even take into account the COVID-19 commodities procured outside of the initiative, nor waste generated by the public, such as disposable medical masks. But this extra medical waste alone has put tremendous strain on healthcare waste management systems around the world. The WHO recommends using eco-friendly packaging and shipping, safe and reusable PPE, and recyclable or biodegradable materials in the current COVID-19 response and future pandemic preparedness efforts.
Hello, I'm Wade Lee. Thank you for joining us on this week's FUNDAY News. Here are your top stories. Over 2 years now since the outbreak of COVID-19, slowly but surely there are signs of normalcy being restored across the globe. Denmark has lifted all COVID-19 restrictions on February 1st and becomes the first EU country to lift all restrictions. Prior to Denmark, on January 24th, Scotland reopened nightclubs, ended limits on hospitality and attendance on indoor events, including indoor contact sports. Media reports Finland also aims to remove all curbs put in place to check the spread of the Omicron COVID-19 variant at the beginning of March. The World Health Organization also began recommending nations to lift or ease their existing COVID-19 related travel restrictions in order to help recover the economy. Though the UN agency continues to warn nations to keep testing, sequencing, and stay alert. Taiwan remains cautious as before, but it will lift the entry ban on migrant workers from February 15th with the same restrictions as before.
Media reports that from February 1st, Danes will no longer be required to wear face masks or present COVID-19 vaccination passes or a recent negative test result. Danish Prime Minister Mette Frederiksen said, "We say goodbye to restrictions and welcome to the life we knew before." Because more than 60% of people in Denmark have received 3 doses of the vaccine, only visitors to Denmark will still be required to present proof of vaccination. Hospitals and nursing homes are being advised to keep certain restrictions, like face masks and vaccine passes. The government of Norway has also said it will lift most COVID restrictions, despite a spike in cases due to Omicron. Hospital admissions have not increased amid the rise in cases, believed to be due to the country's high vaccination rate.
In fact, backed by the high vaccination rate, nations in the European continent like England, Scotland, Denmark, Norway, and Finland are lifting almost all restrictions on COVID-19 pandemic. South Africa also announced on February 1st that anyone without symptoms can continue to live life as normal, even if he or she comes into contact with a COVID-positive person. No testing, no isolation. Should we continue to impose restrictions or lift them? That is still a question to be answered. The World Health Organization recommended the lift or easing of travel restrictions, supporting a continued global economic recovery. Yet the head of WHO warned countries against lifting their COVID-19 restrictions. Director General Tedros Ghebreyesus said that nations should not rely on vaccinations alone to solve the pandemic.
WHO Director General Tedros Adhanom Ghebreyesus said on February 2nd he did not believe that nations needed to return to lockdowns to curb the further spread of COVID-19, while also stressing that nations could not rely on vaccinations alone to solve the pandemic. He noted that the WHO was currently tracking 4 subvariants of the Omicron variant alone. As a result, he called on countries to continue testing, surveillance, and gene sequencing. According to data from the WHO, as of February 4th, the number of confirmed cases in the world was more than 386 million, with the U.S. at the epicenter with over 76 million confirmed cases and a death toll of over 900,000. Some U.S. cities and states have extended their mask mandates, including Washington, D.C. and New York, contrary to measures taken by some European countries.
As of February 5th, when Taiwan reported a noticeable increase in domestically transmitted COVID-19 cases of the last 50 days, the Central Epidemic Command Center said the situation in Taiwan remains relatively stable. The optimistic observation is affirmed by the latest Nikkei COVID-19 Recovery Index. Taiwan was ranked number 1 with a total score of 82 out of 100 in 122 countries and regions. Nikkei noted a higher ranking indicates a country is closer to recovery.
The January edition of Nikkei's COVID-19 Recovery Index was based on data sources including Our World in Data, Google COVID-19 Community Mobility Reports, Oxford's COVID-19 Government Response Tracker, Cerium, and Nikkei Asia Research. According to Cerium data, Taiwan lost 6 points in flight activity, with international arrivals still down 80% in January compared to pre-pandemic levels. In the December edition, Taiwan was ranked number 3. However, due to its performance on infection management, vaccine rollouts, and social mobility, Taiwan topped 122 countries in January, while Cambodia ranked number 2, the United Arab Emirates number 3, and China followed at number 4. As to reopening borders to foreign travelers, the CECC said that is still to be assessed and determined.
Mapping out the trend during the pandemic and the infection management, vaccine rollouts seem to be our biggest concern. However, there's been an oversight. The WHO has found the overuse of gloves, moon suits, billions of used masks, and vaccination syringes have all piled up to become overabundant of healthcare waste worldwide. The WHO now recommends using eco-friendly materials to respond to the current and future pandemics.
The WHO estimates that from March 2020 to November 2021, roughly 87,000 tons of medical equipment obtained through a UN emergency initiative has ended up as waste. In addition, over 8 billion doses of vaccines administered globally have produced 143 tons of additional waste, including syringes, needles, and packaging. The WHO reported that 30% of healthcare facilities worldwide and 60% in the least developed countries were already ill-equipped to handle existing waste loads. The WHO called for investment in non-burn waste treatment technologies and issued recommendations advocating the use of eco-friendly packaging and shipping, as well as reusable equipment and recyclable or biodegradable materials to respond to current and future pandemics.
And that's all the time we have for today. Thank you for joining us on this week's FUNDAY News. Let's make every day a fun day. I'm Wade Lee, your host, and I'll see you next time.